Hello and welcome to another complete Cambridge IGCSE PE lesson, the final topic of the IGCSE Physical Education course, injuries. As always, we'll cover absolutely everything you need to know for your exam, and today you need to be able to describe the causes and treatments for minor injuries, explain the causes of muscle, tendon and ligament injuries and dislocations, and understand how to use the Rice method for treating injuries. Taking part in any sport or physical activity carries at least some risk of injury, but fortunately, serious injuries are relatively uncommon. The majority of injuries suffered in sport are soft tissue or minor injuries, which will be our main focal point for today's lesson. The first thing that you need to be able to do is to describe the causes and treatments for 4 minor injuries, which are common and can usually be dealt with at the scene of the incident by a first aider. Number 1. A blister is a small pocket of fluid that forms in the upper layers of the skin after it's been damaged. Most blisters are filled with a clear fluid or serum, but may also be filled with blood or pus if they become infected. Blisters are caused by the repeated rubbing of skin against an object or surface. For example, they often form on the heels of long-distance runners as the skin rubs against the inside of the shoe. To treat an unbroken blister, avoid piercing the bubble and cover with a plaster or dressing to protect the area and prevent further damage. If a blister has already broken, however, the dead skin should be left intact and the fluid or serum allowed to drain. The area should then be cleaned using mild soap and water and covered with a dry, sterile dressing to prevent infection. Number 2. Bruises are dark patches that appear on the skin when the capillaries underneath are broken. The discoloration occurs as blood leaks from the damaged capillaries and into the soft tissue under the skin. Bruises are caused by impact with a player or object and are therefore common in sports like cricket and baseball, rugby and martial arts. Effective treatments are limited, but cold compresses such as an ice pack wrapped in a towel will help to reduce swelling and slow down internal bleeding. Number 3. Cuts are where the skin is broken, causing damage to the blood vessels beneath, and are caused by contact with a sharp object or an impact such as a clash of heads. Grazes are similar in that blood vessels are damaged, but unlike a cut, the skin is scraped off by rubbing against a rough surface such as a road, tennis court, or artificial pitch. When treating a cut or graze, the first thing to do is stop the bleeding by applying pressure to the wound using a clean, absorbent material like a bandage. Once the bleeding has stopped, the wound can be cleaned and covered with a dressing to prevent infection. Number 4. Winding is defined as difficulty in breathing because of overexertion or a blow to the stomach. It's caused by an impact to the abdomen which makes the diaphragm go into spasm and is common in sports like boxing, cricket and rugby. To treat a winding incident, loosen the clothing around the chest and abdomen, bend forward or move into a crouched position to help breathing muscles to relax, and try to stay calm and take deep breaths. Our second learning objective requires you to explain the causes of 4 more serious injuries which involve the soft tissues, including muscles, tendons and ligaments. A muscular injury, otherwise known as a strain, occurs when muscle fibers become damaged or torn due to overstretching or sudden explosive movements like sprinting or jumping. Muscular injuries, such as hamstring strains, are more likely to occur when the muscles are overused and fatigued, for example, towards the end of a football match or weight training session. Tendon injuries come in different forms, including strains and tendonitis. A tendon, which is the fibrous tissue that connects muscle to bone, may become overstretched or torn when performing sudden, sharp movements such as throwing or jumping. Tendonitis, on the other hand, is a chronic or overuse injury caused by repeatedly stretching the tendon over long periods of time. Tennis elbow and Achilles tendonitis in runners are common examples. Ligament injuries, commonly known as sprains, are caused when a ligament, which is the tough fibrous tissue that holds bones together at joints, is twisted or pulled past its normal range of movement. An anterior cruciate ligament, or ACL strain, is a serious knee injury that occurs in team games like football when players turn or change direction quickly. Finally, a dislocation is caused by a sudden force such as a rugby tackle or fall in skiing that forces a joint out of position. Dislocated joints can lead to swelling and severe discomfort, and may even cause additional damage to the surrounding tendons and ligaments. This image depicts a shoulder dislocation, and you can see that the head of the humerus bone has become displaced from the shoulder socket. In many instances, these 4 types of injuries require serious medical intervention, including operations, but in the immediate short term and for more minor cases, something called the RICE method is used. RICE, which stands for rest, ice, compression and elevation, is a recognised method used to treat soft tissue injuries. It provides a basic series of steps to support, relieve pain and decrease the recovery time of the patient. Rest. The individual should stop playing immediately and rest the injured area to prevent any further damage from occurring. Ice. An ice pack should be applied as soon as possible after the incident and should continue to be applied for 15 to 20 minutes every 2 to 3 hours. This helps to reduce pain by numbing the injured area and lowers inflammation or swelling by restricting blood flow. Compression. The area should be wrapped in a bandage that's tight enough to help decrease the swelling and support the injury, but not so tight that circulation is cut off. Elevation. The injured body part should be raised or elevated above the level of the heart whenever possible. This helps blood and fluid to drain away from the injury due to gravity, which further reduces pain and inflammation. Well done, you've just covered everything you need to know on topic 11.4, injuries. If you benefited from these videos, consider subscribing or giving the video a thumbs up, as this will help more people to discover this content in the future. As always, I hope you found this lesson useful, and best of luck for your final exam.